Hello, and welcome to today's webinar, Hypochlorous Acid Standardization, Benefits for Patients, Staff, and Administration. This webinar is part of the WoundSource Wound Care Product Navigator Series. The Wound Care Product Navigator Series is an easy-to-access, interactive learning lab for healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into a specific product technology. This program will look at utilizing hypochlorous acid to create a standardized plan of treatment for non-intact skin. Our sponsor for this installment is Ergo Medical. My name is Amy McCauley from WoundSource, and before we get started with today's webinar, I just want to go over a few details. As a reminder, Kestrel Health information does not give medical or reimbursement advice, nor do we provide medical or diagnostic services. The content of today's webinar is for informational purposes only. The views and opinions expressed in this webinar and contents are solely those of the presenters and do not represent the views of WoundSource, Kestrel Health Information, its affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speaker, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. Our sponsor has included additional information on today's products. On the right of your console, you will find a list of resources available for download. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located in the tray of your console. At this point, I want to welcome our featured speaker, Bonnie Bowie. Bonnie is a certified wound and ostomy nurse who specializes in the assessment, recommendations, and treatment of wounds and ostomies for inpatient and outpatient populations at Lowell General Hospital. Bonnie, thank you so much for joining us today.
Thank you. In the hospital, there are many choices when it comes to treating non-intact skin. One might argue, too many. Open the door to a clean utility room, and wow, it is overwhelming. Too many options. What do I choose? What is the best one for my patient? When you want to choose a product for wound care, ask yourself the following questions. Number one, is it effective at removing microorganisms to promote wound healing? Number two, is it easy to use and inexpensive? As we all know, it all comes down to money. The dollar amount does play a role when you make a decision for wound care products, so make it money well spent. Number three, is it safe and non-cytotoxic? Treatment choices in wound care should be driven by the complete wound assessment by the wound care specialist. Ensure your treatment plan is always patient-centered. At Lowell General, I began my journey to evaluate Vash. I knew it was going to be just the beginning steps to make change with our current practice for wound cleansing solutions. One of the key components I was looking for was that the product had no contraindications. This was important. Why? Many of our clinical staff are not wound care savvy. Nurses follow the doctor's orders with recommendations, but they are not aware of the contraindications with wound cleansers, specifically when they're used in combination with other advanced wound care products. Why would they? It's no different than asking a nurse to float to another unit they're not familiar with. Are you going to ask a cardiac nurse to float to an orthopedic unit or an orthopedic nurse to float to the ICU? Probably not. It was one of my priorities as a wound care specialist and the pivotal person to continuously evaluate and simplify wound care products that are available and accessible to the staff. We needed to eliminate the multiple options and overwhelming families when the staff enter the clean utility room and make that variable no longer something they have to contend with. My goal was to streamline our wound care cleansing solution to a product that had the capacity to be used with other advanced wound care products. I have done this with other products for the organization as well. Just as many of you may streamline products for your organization other than wound care supplies. Another key element that I wanted to ensure that I addressed when choosing a product was to make sure it was evidence-based. As a magnet-designated hospital, the nurses at Lowell General are dedicated to providing quality, evidence-based, and individualized care. Our delivery of care is the nucleus of patient and family focus. I took the initiative to speak with other wound care specialists in the surrounding hospitals who had trialed the product. These individuals openly shared with me their feedback regarding the product. That is one of the best sources you can go to. In addition to speaking directly with providers, I reviewed multiple articles, but not limited to hydroconductive dressings used in conjunction for the management of complex wounds, adjunctive debridement with hypochlorous acid for healing complex wounds in children. And I felt very strongly to advocate for a change in practice for the benefit of my patients. And looking into standardize a product within your organization, my first step was I attended a wound seminar. As we all know at these seminars, the abundance of vendors with all kinds of products that are lined up in the hallway, you can see for miles. I was interested in seeking out a new wound cleanser at Lowell General Hospital, as the current one that we had clinical contraindications when used with enzymatic debriding agents, as well as other advanced wound care products. I spoke with our sales representative, who actually happened to be at that particular conference, and set up multiple meetings to discuss the product, which included data on the product, clinical studies, and hospitals who are currently utilizing the product. When looking at the cost savings that the organization was going to have using VASH, this slide is a graph that was put together for the cost savings using VASH in comparison to the use with an enzymatic debriding ointment. As we all know, the amount of ointment required for an application on a wound for these patients can be quite significant with large wounds, which ultimately is very, very costly, not only for the product being used, but also for the nursing time involved. This is especially true if you're transitioning your patient from home with the visiting nurses. Many of the agencies that I'm familiar with and my experiences with don't want to do a daily dressing change for any length of time. So if you're able to streamline your recommendations on care to something that isn't daily, it's going to be definitely more receptive to the agency who is going to be receiving that patient at home. Product evaluation and evidence review. I highly recommend when you're attempting to bring in a new product to provide journals to your team that will either be accepting or denying the evaluation to occur. In addition, if you're able to provide your own patient outcomes from sample products that might have been provided prior to going to a more formal evaluation, make your own portfolio of clinical outcomes. Include in that patient feedback and feedback from caregivers if they were the ones who were providing the majority of the care for the patient. This will be a true testament to your clinical expertise and will support your journey for change at your organization. I was able to provide the information on biocompatibility evidence to our infectious disease team, in addition to the images of the patients that I was able to provide care to. After multiple informal meetings regarding mutual patients that both of us were caring for, they were able to see the progress that we had made, and we were able to secure their support for the product. At the time, I was the only WOCN at Lowell General Hospital, so when it came for me to streamline these products, having the infectious disease team advocate for change with me regarding the product that I wanted to bring in was super important. They were able to advocate for change at the value analysis meeting because they were seeing the benefits of the product firsthand, which included a decreased length of treatment. So when we look at challenges with new products, a good solution may not be an easy one. As we can all relate, change is challenging to each of us. As clinicians and wound care specialists, we need to advocate for our patients. As a clinical expert, I didn't decide to bring VASH into Lowell General for myself. I did it for my patients. My goal was to provide my patients with a product that I was confident was going to make a positive impact on their outcomes. The discovery of new wound care products are consistently changing in today's wound care market, but it is the knowledge of the wound care specialist that is the key component in healing these patients. I strongly recommend education as a component to change habits. Our hurdles and obstacles as clinicians may be different at our place of employment, but it is how we choose to make the changes occur. I feel you need to be assertive but patient. Finding that balance may be easy or it may be very challenging. The support of your clinical leaders, managers are of vital importance to be successful throughout your transition period. So my experience in using VASH, I have a few case studies that I would like to share with you. This patient was a gentleman. He was 57 years old. He came in with some necrotizing fasciitis, ended up having a fasciotomy done to his upper extremity. As you can see in the first image, there's still quite a bit of devitalized tissue, including yellow slough, which is present in the wound bed. So we began with installation therapy using Vericlenz choice dressing in conjunction with VASH wound cleansing solution. And after about 2 months, if you look down, you can see that there was a significant change in this wound. The patient had the negative pressure wound therapy for about 2 months, and then we transitioned him over to VASH wound cleanser with the use of Draw-Tex lightly moistened with VASH, followed by a secondary dressing. And he actually did quite well for that. This gentleman had a history of diabetes. We all have that patient who's not 100% on board with good hygiene on a routine basis, and their compliance is always somewhat questionable. And he actually did very, very well, not requiring a skin graft or a skin substitute of any type. This was all without having to go back to the OR for further debridement. We were able to get rid of all of that devitalized tissue without returning to the OR. So he was a pretty successful case here. This was another patient of mine. He was sent to me from one of our plastic surgeons. He was a 66-year-old male who had a connectilectomy, say that fast, for a surgical wound dehiscence. He was a gastric bypass, lost over 100 pounds, and ended up ultimately with a tummy tuck to kind of snug up that loose skin that he had. In addition to that, he had other comorbidities such as anemia, CHF, COPD, depression, diabetes. Kind of ran the gamut like a lot of our patients do with their comorbid conditions. So I got this wound, and it was pretty gnarly. Didn't look real healthy at all. I was a little, thinking to myself, I'm not sure how much we'll be able to clean this up, but we'll give it a go. So we began with installation therapy, utilizing Vericlenz choice dressing again with this patient in the installation of VASH. We started out with 8 cc's of solution that instilled for a dwell time of 4 minutes and a vac time of 1 hour. I know a lot of clinicians out there utilizing this new therapy. We kind of toy and play around with the numbers a bit because there's no kind of magic number out there. It's what have you tried? What have you tried? Oh, keep my time under 3 hours. Make sure that you put, a skin barrier strip around it so it doesn't macerate the skin. We all have our tricks out there. And then eventually we transitioned him to traditional negative pressure wound therapy. And finally, again, this patient finished off his treatment at the very end with the Draw-Tex lightly moistened with Vash, and then a secondary dressing of a foam with an adhesive border. Considering his comorbid conditions, it was kind of in a tricky spot. It was still in a pretty deep skin fold despite his weight loss, so it was a moist area that you were contending with. He did fairly well in not a long period of time. The plastic surgeon was impressed with the installation therapy. She had never seen it before. It was new to her. So for me, it was a win because now I've been able to gain this plastic surgeon to continue to send patients to us to help treat them and make them successful in their wound healing process. This third patient was a tummy tuck. She went to the Dominican, actually, to try to save herself some money, and came back to the United States with an open abdominal wound into the emergency room beside herself that, you know, in spite of trying to save herself a few dollars, ended up with this wound on her abdomen. She was very non-compliant from smoking and eating everything that was probably not appropriate for her. We talked about increasing her protein intake. We talked about maybe utilizing some vitamin C and zinc, and she really didn't want to hear much of what I had to say. She threatened to sign herself against medical leave a few times, but we were able to keep her in. She didn't want the VNA in her home, so she was quite a challenging patient for us. When she was discharged, she agreed to come back into our outpatient setting to continue to have the dressings changed. And she did remarkably well until we got to, if you see at the very last slide, she wasn't completely healed, but numerous phone calls. She just kind of fell off the radar with us, but she did do very well. We cleaned her wound with Vash heavily. We would do like a 5-minute dwell time when she would come into the clinic just to kind of keep the solution on the wound bed to decrease the bacteria count, and then we would continue to moisten Draw-Tex with Vash and utilized a secondary dressing over that up until the point where, like I said, she didn't come back into the clinic to be seen. So I'm not sure what happened to her, but we really did make some nice progress with her wound. So if we wrap up my experiencing at Lowell General Hospital with the implementation of Vash as the wound cleanser for our patients, we've used it for cleansing, for moistening, for packing. We've used it quite often in conjunction with negative pressure wound therapies as appropriate. I'll vac anything, and I'll add Vash to it if I can. We do a lot of education for our staff. We're very diligent in our efforts to continue to educate our staff on products through numerous platforms. Myself, as one of the WOCNs here, educate staff when I'm in seeing a patient. We have an annual skills day that all clinical staff are required to attend. We have rolling in services multiple times a year in which I utilize sales reps to help assist with that. We have a wound care committee and a skin wound assessment team of staff that have a little bit more of a knowledge base, that are kind of leaders out on the floors for staff to kind of bounce different ideas off of. So we really try to keep the information fresh. We try to catch those new hires. We try to catch the new grads. We have a new grad program here, and I spend a day with them, giving them about an hour and a half overview on wound care and how to document and identify and measure. So we really try to make education a focus with our wound care products when we're bringing in new products and when we continue to use products here at the hospital. And that is our presentation today on VASH. And does anyone have any questions?
Bonnie, thank you so much for that presentation. We are now going to begin our Q&A session, and joining us for this Q&A session is Dr. Chakravarthy, the Vice President of Medical Affairs for Ergo Medical. If you have a question for Bonnie or Dr. Chakravarthy related to today's program, VASH, or Ergo Medical, please submit your questions using the Q&A app found on your console. We'll try to get through as many questions as we can in the next few minutes. Now, for our first question, Bonnie, does VASH become toxic to the skin over a certain period of time? And how long should you continue treatment with VASH?
VASH is non-cytotoxic, it's non-irritating, non-desensitizing, and it's completely safe. As with any dressing recommendation or plan of care that you're going to have for your patient, you need to assess it on a regular basis, obviously, and make any changes according to, but not limited to, the presentation of the drainage, presentation of your wound bed, as well as the peri-wound bed for wound healing.
Great, thank you. And do you consider surgical incisions non-intact skin, and would you then use VASH for routine cleansing?
I would, specifically if it's an acute surgical wound, I would definitely use it as a routine cleanser, just to kind of give that, you can give a little bit of a dwell time over it by taking a 4x4 and kind of moistening it with VASH. And then whether you're putting on a protective dressing or whatever the provider is requiring over that surgical site, I would definitely use it for sure.
Great, thank you. And before our next question, I want to invite our audience to take a moment to complete our quick poll, which should display on your screen here momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. Now, while our audience is answering that question, Bonnie, here's something for you. This audience member wants to know about hypochlorous with silver. Does it come in a gel form?
There will be a product that will be coming out in the next few years, which is in gel form of VASH, but is not available yet. So that will be something that will be up and coming in the future.
That's very exciting. Thank you. Here's another one. What is the pH of the solution? What is the hypochlorous concentration?
You want to keep the pH between 3 and 6 with wound care, which VASH is right within that range.
Great. What is the minimum amount of time you would soak a wound in VASH?
3 to 5 minutes, so 3 being on the lower end. You know, we all in our practice are crunched for time and compliance of patients. But definitely, you know, you want to err more to the 5 minutes if you can. So I would say a minimum of 3 to 5.
Great, thank you. Here we go. Do you ever use VASH with instillation therapy?
I am a huge advocate for VASH with instillation therapy. If I can put a vac on something and kind of up my game a little bit by instilling VASH into the wound, because I'm allowed to soak the VASH now with my dwell time, I definitely will. It is a huge game changer for your patients that have a wound vac. and I would definitely recommend it. Unfortunately, it's only used in the inpatient setting. A lot of hospitals, acute care, rehabs are using it, and I definitely am a big advocate for it.
Great, thank you. Here's a product availability question. Can you get Vosh in Canada?
That I'm not sure of. I would have to refer to Dr. D for that because I don't know if it is available there because I don't practice in Canada. So I'm hoping he can help me out.
Yeah, I can jump in. Yeah, available soon. We had to take care of some regulatory issues which we had. So we hope if all goes well, it'll become available by end of October. So yes, absolutely, we're looking forward to it.
Great. Well, thank you for that, Dr. D. Bonnie, what type of patients do you typically order Vosh for, and what's the longest you've used it for?
I use Vosh for every one of my patients who has an open wound. I don't use any other products to clean their wounds. And obviously the length of time would be contingent upon how well the wound was doing and how close we were getting to healing the wound. But I have used it for months, depending upon the acuity of the patient's wound in order to make it heal. So there's really no end point. You can use it as long as you need to in order to heal your wounds.
Great. Here's an interesting question.
Sorry, I just wanted to jump in on the pH question a little bit in more depth because there's a lot of confusion in this area. The pH of the product, we put it on the bottle. It says NZT 5.5 because it is not meant to exceed 5.5 even at the end of its shelf life. What that means is that you get pretty much 100% pure hypochlorous acid with no contamination of any hypochlorite or Dakin-like species present. So now, as it happens, the pH range of Vash is also very, very nice with respect to wound healing requirements. This is a coincidence, actually. I think it's a coincidence that the pH of the healing wound is meant to be in the acidic zone, but not too acidic, not below 3, and not at all basic. So our Vash is formulated to be in that sweet spot where it is 100% hypochlorous acid. And with respect to how long one should be treating it, Bonnie was absolutely right. You know, clinics are fast-moving places. We do recommend that well-soaked gauze be applied to the field for at least 5 to 10 minutes. Vash goes to work right away on a mechanical sense in terms of loosening microbes and necrotic tissue, and you then absolutely scrub it well, clean it like you mean it, and then you're ready to pat it dry and put on your secondary dressing, which may or may not be soaked with Vash. You know, Bonnie has a very interesting paper coming up where Drotex is being soaked with Vash and being applied to the wound after the gauze. And you will, I don't want to steal a thunder, you will see this paper in next month's Wound Care Journal, you know, wound prevention and management. Sorry to jump in. Thank you.
Thank you, Dr. D. That was really helpful. Bonnie, back to you. How are you handling maceration of the Periwound with Vosh use?
So what I typically do, depending if I'm utilizing installation therapy, so using Vosh in conjunction with negative pressure, I will use skin barrier strips. Another name would be an Ekin ring. And I will kind of picture frame it, so to speak, around the wound bed itself to try to limit any type of solution that might seep out onto the peri-wound bed. And for my patients where I'm moistening Drotex and applying it directly to the wound bed, I typically will place a dry piece of Drotex on top of my moistened piece. And I rarely run into any issues with some Periwound maceration. Again, it's lightly moistened, it's not soaked, so it's not dripping on the sides of the wound, and it seems to manage fairly well.
Great, thank you. This audience member, well, first they say thank you for the presentation, but then they want to know, can Vash be used with silver products?
Yes, absolutely. There is no product out there that it's not compatible with, so you can definitely use it in conjunction with your silver products out there.
Yeah, I just want to jump into that. Exactly right, Bonnie, thank you. What you don't want to do is soak your silver product with Vash and apply it to the wound, because you will likely reduce the effectiveness of Vash. You want to use a gauze to soak your wound. Once you have used it, you pat it dry, and then apply your silver dressing. That will be there for up to 7 days. So that's the best way to use them together, because the role of Vash is to be used with a gauze in a clean it like you mean it way on the wound with fluff and microbes, so that you can mechanically remove it. And there's plenty of published evidence on, if you do it properly, your wound level bioburden will go down, and that has been presented with quantitative microbiology papers by, for example, Jeff Shupp out of MedStar has presented that. So just want to clarify on that. Thank you.
Thank you. And we have time for one more question. Bonnie, what would you say to other clinicians resistant to change that love saline and want to see a randomized control trial comparing Vash to saline?
I would say definitely do your own trial at your organization, and bring your evidence from your practice to your team that's going to help either support or hopefully not deny the product coming in, and they will see a huge change. That's what we did here. We did our own clinical studies as well, and we were able to present them to our value analysis team. And truly, when you do the study yourself and see the change in progress in the wound, it's not only gratifying to know that you're doing the right thing by your patient, but you're definitely making a change and you're improving their quality of life while doing so.
Indeed. Thank you, Bonnie. And just to let you know, publications are available where Vash has been compared with non-hypochlorous acid solutions like saline, for example, and you do see a wound level bioburden reduction to the mechanical activity of Vash with a gauze when you clean it like you mean it. And that has been published. That has been published in a comparative trial. We'll be glad to share it with anybody who asks for it. Thank you.
Thank you. And before we end today's program, Bonnie, do you have any final thoughts for our audience today?
I do. So Vash has definitely made a change at Lowell General Hospital for both our staff and our patients. When you select a product, you need to pick a product that works, and Vash has been proven clinically to do so. Our patient outcomes continue to surpass our expectations. We're decreasing our length of treatment times. So I strongly urge you, if you haven't already tried this product, to definitely give it a try and see if you can get it into your organization. It certainly has made a difference for us in our practice, and I'm hoping that it will make a difference for your practice and particularly for your patients.
Thank you. And that's all the time we have for today's program. Thank you for your questions. If your question was not answered today, an Ergo Medical representative will reach out to follow up. This webinar has been recorded and will be made available in full on demand after the program. Please look for our follow-up emails that will alert you when the on-demand recording is available so that you can review any material you missed or simply go over the program again. Also, you'll be redirected momentarily to a form to indicate your interest in speaking with the sales representative for Ergo Medical. I would like to extend a warm thank you to Ergo Medical for sponsoring today's program. On behalf of today's presenter, Bonnie Bowie, as well as the teams at WoundSource and Ergo Medical, thank you for joining us and for taking some time to view this webinar. Have a wonderful day.